My name is Dr. Karan. I'm a surgeon in the NHS, and I've been involved with medical education for around a couple of decades, around 15 years. Back from the bad old days of YouTube, first forays into medical education. And it really is a revolution and an evolution. I mean, it's really revolutionized the way we're coming to terms to online learning now, especially. And I just want to give you a bit of an insight as to how I got involved with medical education and what's happened over the last 15 years or so. So if you go to the next slide, please. So it all started with phone. So, if you're involved in any capacity in online learning, or you're a learner yourself, free open access to medical education. We all probably know this term by now, and you probably even recognize life in the fast lane. I think you've probably all come across it as well. Back in the days, the kind of early 2000s, early to late 2000s, there was just an abundance and plethora of these online blogs and these web-based websites, Life in the Fast Lane, Rebel EM, all of these sites which provided useful snippets of information. And this was really the start of the self-directed learning that you had. Now we've got obviously the new waves of teaching, flipped learning and, flipped classroom and all of these things. But this is how it all started. And if you were too shy to ask questions in lectures, or you didn't go to lectures, you could just go online and find this wealth of information and just learn from the comfort of your own laptop, which is fantastic, really. But the key here is that all of these things, this is the pre-influencer kind of era, as we call it. And, the key thing here is this was learning for healthcare students and healthcare staff, and not necessarily the public. We'll come on to that. Next slide, please. So, obviously we started off with all these text-based sites and all of these things, which were fantastic. If you're a medical student, or even if you're a junior doctor and you wanted to brush up on your acid-base balance that you forgot, in med school, and suddenly your boss asked you to figure out what the acid-base abnormality is, and it was a fantastic way. But we quickly realized and accepted that we needed to provide different mediums of learning, and that's when visual learning, video format, short video formats such as YouTube, that was crucial as well. And back in sort of the early 2010s, you had various YouTube medical channels popping up from Dr. Najib, and I think probably most of you know Dr. Najib, Osmosis, the short form videos, of explainer videos, all of these things. And my first foray into medical education was on YouTube with the Oski Station. Ever heard of it? When I was a second or third year medical student at Imperial College, there was definitely a lack in the medical education sphere of these short format videos and how to do various examinations and things like that. And this was really the bad old days as YouTube, as I like to call it, not because of the approach was bad, but probably the reach and engagement of all of these various things were limited by potential for audio or visual quality. And this was just the kind of early first steps of medical education on YouTube. There's lots of information on there. It's hard to see what's accurate. Are people actually doctors or medical students? Some of the videos are not English language, which again limits the applicability and the reach. And again, there's no peer review system on YouTube to this date as well. So there's lots of false information, potential for false information anyway. So, YouTube really, in the kind of old days when there was a limited community in terms of medicine on YouTube, I guess that was still the start, and we've flourished since then. And now, you have no trouble finding really good, accurate information on YouTube. Next slide, please. And we quickly acknowledged, even though YouTube was fantastic for visual learning, as we sort of evolved in terms of our learning methodology and even, the user needs, we began to evolve into more short formats of learning as well. Facebook, Instagram, Twitter, and now TikTok as well. And all of these formats, these even shorter formats than YouTube. And although YouTube, even to this day, has about 50 million people watching videos per day, the reach of YouTube and various things, it lends itself to more longer format videos. And busy professionals, busy medical students, and even busy public, they just want nuggets of bite-sized golden information. And short format sites like Instagram provide that. 1-minute videos, well-curated photos with, you know, a limit on the number of characters you're allowed on the text. That just gives someone, you know, the exact information they need. And that's why it became very successful. And although, you know, there's lots of health influencers on YouTube, there's been a, you know, a boom in the sort of medical influence as well. And it all started, you could argue, with Dr. Mike, you know, a physician from the USA. You know, started off as the world's sexiest doctor, and then slowly evolved into providing really good medical education content, both on Instagram and on YouTube as well. And this is really the kind of everything picked up there. And we've got a wealth of medical influencers on Instagram. You know, if any of you are on Instagram, you probably follow a dozen or so medical influencers, and I think that's fantastic. But, you know, you could argue we've seen a slight decline in Instagram in terms, well, certainly in my opinion anyway, because all of these social media formats have their own shelf life. And we've seen, you know, that with Instagram, there's certainly been some decay in reach and engagement on Instagram, but luckily that gap has been filled by, next slide please, TikTok. It's the new kid on the block. Started off as a lip-syncing, dancing music app from China, and it's quickly evolved into something completely different. And there's a real drive on TikTok to push educational content, dubbed EduTalk. And being involved in medical education for a number of years, this was the next logical step for me. And although it started as a bit of fun, it quickly evolved into something else for me as well. And, you know, I found that there's a greater reach you can have on TikTok. It's even shorter format than Instagram. You can have 15-second videos on just nailing home key points. You can add music to make it fun. And, you know, it certainly allowed me to bring something I like to call edutainment or infotainment, you know, providing information, but also education at the same, or entertainment at the same time. And I think the key thing with TikTok and Instagram, certainly, which has never been done before on all these other websites like Life in the Fast Lane and those kind of early forays into medical education, is it's kind of a trimodal model of approaching education. You're not only educating healthcare medical students or nursing students or junior doctors or anyone in healthcare, but you're educating patients. There's a lot of patients who reach for social media to find out things about their disease pathology. There's members of the public who are laymen and want things distilled in a very simple way. So all of these various cohorts of people are now tuning into social media, and they rely on doctors and nurses and scientists and healthcare professionals to, you know, as sources of inspiration and people they look up to provide accurate information. So, you know, I think that's fantastic. And we have lots of TikTok doctors and nurses. I include myself in that. And, you know, potentially some backlash as well about influencers being on social media. There's lots of gray area about what you should promote and all of these things. But, you know, I think certainly having a body of healthcare professionals on social media is definitely for the better rather than the worse. There's, as we know, there's you know, a wealth of misinformation out there, and having healthcare professionals out there can help to hopefully clarify certain myths and you know, various kind of things, controversial topics and conspiracy theories that we've seen pop up over the years. Next slide, please. So, you know, obviously with the growth of these short format forms, Twitter, social media, Instagram, TikTok, all of these things, you have lots of people who've gone viral for various reasons, either, you know, educating people or, you know, doing all these various silly trends and dances. And, you know, it all started, you know, with Dr. Mike. I mean, he started off his life on Instagram with several million followers, and then quickly became a household name on YouTube as well, providing weekly, you know, educational value for, you know, everyone. As I said, the members of the public, someone who has no connection to medicine and would just like to know a little bit more about what we do and what, you know, diseases are and various things. And, you know, this format has been replicated and sort of copied by various people to great success as well. And, you know, mostly I would say the large chunk of people on social media in the healthcare sphere provide excellent value. And I count several colleagues who are on there, mainly on Instagram and TikTok and YouTube, who, you know, are fantastic in the work they do. But, you know, often you will get the occasional, you know, promoter who will promote some products for money and all of these things. And it's just something which is inherent in the nature of social media. It's something, again, which is not peer reviewed. There's instantaneous publishing. It's 24/7. So someone has access to this information unrestricted temporally by time or geography. So it's always there, and there's always a trail. So any negative or misinformation out there will perpetuate, as we've seen with the pandemic documentary and all of these various things. And that's the ugly side of social media for me. But, you know, I think overall, if you look at the last 15 or 20 years in social media, going from text-based crib sheet websites to gamified apps to short format social media, and now the new kid on the block, TikTok, which has an incredible reach, particularly a young audience as well, inspiring the new generation of doctors and nurses and healthcare professionals. I think that's fantastic. And yeah, I think we need to watch this space, because I'm sure in a few years there'll be, you know, the next TikTok will be around the corner, and it's important to get in there first before anyone else to, you know, spread some knowledge and some good news.